Hello, seniors, and welcome to Long Live Seniors, your trusted home for health, wellness, and joyful living. Today, we're talking about one of the most vital yet often overlooked parts of healthy aging: sleep. Good sleep is not a luxury, it's a necessity. It keeps your body strong, your mind clear, and your mood balanced. According to the CDC and Medical News Today, older adults still need about 7 to 9 hours of sleep every night, roughly the same as younger adults. Yet, many seniors struggle to get that much. Too often, poor sleep is dismissed as just part of getting old. But in truth, the science says otherwise. Aging changes how we sleep, yes, but that doesn't mean restful sleep is out of reach. In this talk, we'll explore how sleep works, how it changes as we age, and what evidence-based habits can help you reclaim deep, restorative rest. Let's begin with why sleep matters so deeply. When you sleep, your body is at work repairing, restoring, and rebalancing. During quality sleep, your immune system strengthens, your heart and blood vessels rest, and your brain processes memories and emotions. The CDC emphasizes that consistent, high-quality sleep reduces your risk of chronic illnesses like diabetes, heart disease, high blood pressure, and stroke. Research from Medical News Today shows that sleep helps regulate metabolism and maintain a healthy weight, while protecting the brain from cognitive decline. Among seniors, getting enough sleep can lower the risk of depression, reduce falls, and enhance overall well-being. Lack of sleep, on the other hand, increases daytime fatigue, irritability, and forgetfulness. In one large survey, nearly 70% of older adults reported some kind of sleep difficulty, falling asleep late, waking too early, or waking several times through the night. Even losing 1 or 2 hours of sleep can make you feel groggy and unwell during the day. So it's clear, sleep is not optional. It's a foundation for good health at any age. Now, what actually controls when we feel sleepy and when we feel awake? The answer lies in our internal body clock, our circadian rhythm. This rhythm runs on roughly a 24-hour cycle, controlled by light and darkness. In the morning, daylight enters your eyes and tells your brain it's time to be alert. As the sun sets, darkness triggers the pineal gland, a tiny structure deep in your brain, to release melatonin, the hormone that signals sleep. Melatonin rises in the evening, stays high through the night, and drops again with morning light. That's why spending time in daylight, especially early in the day, is so powerful for sleep. It helps reset the clock every morning. But as we age, the system starts to shift. Researchers at the Sleep Foundation explain that after about 60, many people's internal clocks move forward. You may start feeling sleepy earlier in the evening and wake up earlier in the morning, even before sunrise. This shift, called a phase advance, is a normal part of aging. So if you find yourself dozing after dinner or waking at 4 in the morning, your body clock may simply be running earlier than before. Regular morning light and steady sleep-wake routines can help align that clock again. Another change with age involves melatonin itself. In our youth, melatonin production is strong. Teenagers, for instance, have abundant melatonin and often fall asleep easily once it gets dark. But after 40, natural melatonin levels begin to decline. By the senior years, the nighttime melatonin peak is lower. That means the biological signal telling the body to sleep now is weaker, which can lead to lighter sleep and longer times falling asleep. Fortunately, you can support your melatonin rhythm naturally by dimming lights in the evening, turning off screens, and keeping the bedroom dark and calm. Now, let's take a look inside a night of sleep. Sleep is not one long, uniform state. It's made up of repeating cycles, each about 90 minutes long. Every night we move through 4 main stages: light sleep, deeper sleep, deep slow-wave sleep, and REM sleep. In stage 1, you're drifting between wakefulness and rest. In stage 2, the body relaxes more deeply. Your heart rate slows and your temperature drops. Stage 3, or deep sleep, is the most restorative stage. Here, the body repairs tissues, builds bone and muscle, and strengthens the immune system. Waking from deep sleep can feel disorienting because the body is in true repair mode. Finally comes REM sleep, rapid eye movement, when most dreaming occurs. During REM, brain activity rises, and this stage is vital for memory, learning, and mood balance. A healthy sleeper cycles through these stages 4 to 6 times per night. Early in the night we get more deep sleep. Toward morning, REM becomes longer. Every stage matters. Deep sleep restores the body, while REM refreshes the mind. As we age, though, the balance of these stages changes. Older adults spend less time in deep and REM sleep and more time in light sleep. The result? You may sleep through the night but still wake feeling unrefreshed. Fragmented sleep becomes common. Brief awakenings throughout the night, sometimes so short you don't remember them. Pain, medications, or bathroom trips can add to the disruption. The Sleep Foundation notes that seniors often average only 6.5 to 7 hours of sleep per night, even though the CDC still recommends 7 to 8 hours for adults 65 and older. But experts at PubMed and ResearchGate remind us poor sleep is not inevitable. While age affects the architecture of sleep, healthy routines, light exposure, and activity can greatly improve its quality. Sleep difficulties are treatable. They're not a natural, permanent part of aging. Let's discuss some of the common sleep problems older adults face. The first is insomnia. Trouble falling asleep, staying asleep, or waking too early. Around 1 in 5 older adults meet the criteria for chronic insomnia, and up to half experience insomnia symptoms. Causes include stress, chronic pain, medications, or underlying conditions like arthritis or heart disease. Insomnia leads to fatigue, mood swings, and decreased focus. The gold standard treatment, according to medical research, is cognitive behavioral therapy for insomnia, or CBTI, a structured program that helps retrain your sleep patterns without medication. Another challenge is fragmented sleep, frequent awakenings during the night. This can result from bladder changes, joint pain, or lighter sleep stages. Addressing underlying causes, like managing nighttime pain or limiting late evening fluids, can help. Creating long, uninterrupted sleep stretches is the goal. Some seniors experience early morning awakening, where they wake up at 4 or 5 in the morning and can't fall back asleep. That often reflects the natural circadian shift we mentioned. In such cases, going to bed slightly later and keeping a regular wake time can restore balance. One more important condition is sleep apnea, when breathing repeatedly stops and starts during sleep. This condition is very common with age, partly because of weight gain and weakened throat muscles. Studies from the American Academy of Sleep Medicine Foundation found that over half of adults aged 65 and older are at high risk for sleep apnea, yet fewer than 10% have been tested. The signs include loud snoring, gasping for air, or feeling exhausted even after a full night's sleep. Sleep apnea can raise blood pressure, strain the heart, and worsen memory, but it's treatable. Sleep studies, CPAP machines, and behavioral therapy can make a dramatic difference, and Medicare often covers these evaluations. There's also restless leg syndrome, that uncomfortable urge to move your legs at night, and periodic limb movement disorder, where legs twitch repeatedly during sleep. These can seriously disturb rest but can be treated by a doctor. The key message: if you're sleeping poorly, don't assume it's just aging. There are solutions, and science-based ones. Now that we understand the challenges, let's focus on what really helps. Sleep hygiene. The healthy habits that create good sleep. First and foremost, keep a regular sleep schedule. Go to bed and wake up at the same times every day, even on weekends. The CDC emphasizes that this consistency strengthens your internal clock. Second, get bright light exposure in the morning. Sunlight is your natural circadian reset button. Just 10 to 15 minutes outside or by a bright window in the morning helps anchor your rhythm. At night, do the opposite. Dim the lights, reduce brightness, and signal your body that it's time to wind down. Third, create a restful bedroom environment. Keep your room dark, quiet, and cool. Ideally around 65 to 68 degrees Fahrenheit, or 18 to 20 degrees Celsius. Use blackout curtains, eye masks, or gentle white noise if needed. Make sure your mattress and pillow provide comfort and support. Fourth, limit screens before bed. Phones, TVs, and tablets emit blue light that suppresses melatonin and delays sleepiness. The CDC recommends turning off screens at least 30 minutes before bed. Instead, you can read a book, listen to soft music, or practice relaxation exercises. Next, develop a calming bedtime routine. Spend the last 30 to 60 minutes before sleep unwinding. You might take a warm bath, stretch lightly, or do deep breathing or meditation. Avoid heavy discussions or intense TV programs right before bed. Then, watch what you eat and drink. Avoid heavy or spicy meals within 2 to 3 hours of bedtime. If you're hungry, a light snack is fine. Limit caffeine after about 2 in the afternoon. Remember, caffeine lingers in the body for hours. And while a glass of wine might help you fall asleep faster, research shows alcohol actually fragments sleep later in the night, reducing deep and REM stages. Another important principle: use your bed only for sleep and intimacy. Avoid watching TV, reading emails, or eating in bed. This helps your brain associate your bed strictly with rest. And if you can't fall asleep within about 20 minutes, get up and do something calming under dim light until you feel sleepy again. Be mindful of napping. Short naps, 20 or 30 minutes, can boost energy, but long or late afternoon naps can make nighttime sleep harder. If you nap, aim for before early afternoon. Stay physically active. The CDC recommends at least 150 minutes of moderate exercise weekly. Physical activity helps you sleep better, improve mood, and maintain strength. Just avoid vigorous workouts within 3 hours of bedtime. They can be too stimulating. Gentle walking, yoga, or even gardening are excellent daytime activities. Review your medications. Some blood pressure drugs, decongestants, or steroids can interfere with sleep. Others can cause drowsiness or nighttime wakefulness. Talk with your doctor or pharmacist about timing adjustments, but never stop a medication without professional advice. If your mind tends to race at night, reduce worry before bed. Try writing a short to-do list or gratitude list to clear your thoughts. Gentle meditation, breathing, or prayer can calm the nervous system. If sleep issues persist, keep a sleep diary. Jot down your bedtime, wake time, naps, and how rested you feel. Over a week or two, this pattern can reveal clues that help you and your doctor find the root cause. These simple habits, supported by the CDC, NIH, and Sleep Foundation, are proven to make a big difference. They may sound small, but together they retrain your body and mind to trust the rhythm of sleep again. If, despite your best efforts, sleep problems continue, don't hesitate to seek help. Persistent poor sleep can point to a medical issue or a diagnosable sleep disorder. Talk to your healthcare provider. Cognitive behavioral therapy for insomnia, CBTI, is highly effective, especially for seniors. In some cases, a short course of medication might be used, but doctors are cautious since older adults are more sensitive to drug side effects like confusion or falls. Non-drug approaches remain the safest and most sustainable first choice. Let's summarize what we've learned. Restorative sleep in older age is achievable by understanding how your body's clock works, how melatonin and sleep cycles change, and by adopting consistent, healthy routines, you can improve sleep dramatically. Seniors still need 7 to 8 hours of sleep each night, even if the timing shifts earlier. It's not normal to feel tired all the time, and it's not too late to change that. Healthy sleep hygiene. Regular schedules. Morning sunlight, a peaceful bedroom, limited caffeine and screens, and consistent activity all contribute to better rest. And remember, better nights lead to brighter days. Improved mood, sharper memory, and stronger immunity. Imagine waking up refreshed, with energy for the day ahead, going for a morning walk, enjoying breakfast, spending time with loved ones, or reading a good book. That's what good sleep gives you, more of life itself. So tonight, treat yourself kindly. Dim the lights, breathe slowly, and allow your body to unwind. You've earned your rest. Sleep is your body's natural healing process, your nightly restoration. Sweet dreams, seniors. And may every night bring you closer to health, happiness, and peaceful renewal. Until next time, remember, sleep well, live fully, and long live seniors.